Thank you so much, Shamila. That was really fascinating, and thank you to all our speakers. There's a few minutes now for questions. Has anybody got any questions? If you have, could you raise your hand? I'm not seeing any hands going up. Do we have questions from the chat, from the team?
Hi, yeah, there's one from Martin Hatton, who said, can someone talk a bit more about organisational levels in terms of professional and personal enhancement to build a trauma-informed practice nation? Sandra, that might be a good one for you, if I can direct it towards your thanks.
Yeah, absolutely. Thanks for the question. Oh gosh, I'm trying to think how best to answer it in a way, because I could talk, and often do talk about this for days at a time. So I suppose at its basis, we would recognise that the organisational leadership element of this is a absolutely fundamental part of the implementation planning for all of this. And what I would draw your attention to is the National Trauma Training Plan, which sort of hopefully talks through all the different elements about all of this. And the flowers sort of drawn attention to the fact we need consideration at a policy level and environmental level. One of the things I didn't manage to say in my presentation, just because I ran out of time, is absolutely, if we want to enable our staff to be able to do this, our workforce, paid, unpaid, whoever they are in the workforce, to be able to do this, there is a reason why airplanes always tell you to put your oxygen on first. And that's because we have to make sure our staff are able to do this work and be maintained in our organisational level is absolutely critical to that. So there's just all the different, I mean, I liked Dan's description of the different tiers that you looked at, organisational policy, environment and all the other bits as well. Is that just a big waffle, or does that start to answer your question? Our stilt training is also moving online, so that might be something else that might be of interest.
Thank you, Sandra. I'm not seeing any other hands, colleagues. Oh, yes, Sylvia Bakey. Is that how you pronounce your name, Sylvia? Yeah.
Yes, Sylvia Bakey. Yeah, I just wanted, it was a bit of what Dan said, and just pick up. So trauma-informed practice for me, I've been involved in it for years. And I worked in drug and alcohol services, worked with prostitutes, and now working in children's services as well. One of the things that's really poignant for me is that it can come across as a really sweet thing to do for children, but actually it's the opposite when we're working with adults who actually their trauma can feel quite overwhelming. And particularly when you think of drug users who can just kick off and have behaviours that aren't attractive. And I suppose it's just my point about that we need to be aware that it's not always just that small child, but actually we're dealing with really complex individuals with really complex behaviours. Actually, we need to be self-aware ourselves of our own stuff before, and that's the biggest empowering tool that we could have in terms of working with other individuals, so that we're not putting our own stuff onto our clients as well. And that it might not be the sexiest thing that we're doing, but actually it might be quite difficult. And your comment at the end of your slides, Dan, was a really important one for me, where you wrote that, you know, it's that hard piece of work. And actually that's the bit where you're doing the hardest piece of work then and make the biggest impact.
That's really nice to hear. Thanks ever so much. But I totally agree. It's when the behaviours are so extreme because they're rooted in such extreme experiences that the really difficult things happen, and it's not futile. There's still really worthwhile things possible, but it's not an easy gig. It's not a simple click of the fingers. But thanks.
Thank you, Sylvia. Thank you, Dan. Maureen Swanee, you've got a question.
Thank you. It's more of a comment really than a question, and I apologise, I missed the first kind of 20 minutes. I think there's a danger, and there's probably always been a danger, that trauma-informed practice and trauma-trained workforce becomes a bit of a buzzword for some parts of the organisation, the exec teams and things. And an example would be, so I work in children's services and was asked to come along to this today because it was deemed that would be the most appropriate person to come, but in the way that the previous person was speaking about, it's not just related to children and young people. And I think this is a really opportune time where so many of our workforce are having anxieties about the pressures of work, that if we can get this across now, as it's just the way it should be, because it just makes sense. It's how we should all be with each other anyway. And I've spoken to Shamila before, and I just love listening to her. I would listen to her all day. But I think if we could just get that as part of it's just how we do this, then could stop it from becoming, you know, it's just another buzzword that people will start to throw into their service plans and things. And I think there's a real opportunity at the moment with all the things that's happening around COVID. So just wanted to throw that in there. Thank you.
Thank you very much, Maureen. I'm going to give Shamila the last word. Shamila, would you like to respond to that?
Are you sure you want to do that?
Yeah, on you go, Shamila.
I think you're absolutely right, and what you just said there, and that's the kind of the place we need to go with this. This is just what we do, and I suppose that's what I mean when I say things like, you know, doing things differently to when they had previously been done, and with that I mean, and how we're including people with lived experience. For me, that's the key here, when we start to see that open up and moving in the direction that it's beginning to, but some people were having to drag along through that process. And I think when we start to see the establishment of things like a lived experience lead operating independently, working with local authority areas across the country and ensuring that not just communities are consulted when things happen, but lived experience led organisations, and find different mechanisms to make this within organisations. For me, it sits within learning and development, because that's how we begin to trickle it through to the whole workforce. So yes, it needs to become just a part of what we do within our organisations, within our systems. And I hope me keeping on banging that drum at places like this, we start to see those spaces opening up a bit more.
Thank you very much, Shamila. Thanks, colleagues, for your questions. Sorry, we've run out of time, and you'll have noticed that we're running over time as well. So we're running about 10 minutes late at the moment.